Hi, and welcome everyone to our latest town hall for employees getting ready to reunite with colleagues and students on campus this fall. I'm Kelly Tyrell, and I'm the Director of Research Communications and a science writer here at UW-Madison in University Communications. I use she, her pronouns. Though I'm in the office right now, like many of you, I have spent much of the last 18 months working from my home. We are all taking steps to protect ourselves and one another from the virus that causes COVID-19. I also know that many of our colleagues have remained on campus throughout the pandemic, taking steps like wearing masks, physically distancing from others, undergoing mandatory testing, and working in environments at reduced density. Now, we're nearly all planning to come back together again on campus since we have safe and effective vaccines that have significantly reduced the risks that the virus presents, especially to those most vulnerable to the worst effects of COVID-19. This includes people 65 and older and people from some communities of color. I am so encouraged by the fact that since widespread vaccination began last winter, we have seen a dramatic reduction in deaths from COVID-19 across the US. And here in Dane County, more than 8 weeks have passed without a single death from the virus. While there's been a recent uptick in people hospitalized for COVID-19, the vast majority of these instances are among unvaccinated adults. In communities like ours, where vaccination rates are high, we continue to see low infection rates, including among children too young to be vaccinated right now. I am personally grateful for the vaccine I received and have recently been reintroducing to my own life the activities and visits with friends and family that I have missed since the pandemic began. But you're not here to listen to me. You're tuning in to hear from our panelists who have each worked daily throughout the pandemic to make sense of information that has, at times, changed hourly. And before I introduce them, and before we go further, I'd like to acknowledge that the land UW-Madison inhabits is the ancestral home of the Ho-Chunk Nation, one of the 12 First Nations of Wisconsin. We invite you to learn about the indigenous communities that have called this land home since time immemorial. By acknowledging our past, we are able to move forward toward a shared future. These truths are part of the Wisconsin experience, and we honor them today. Now, our conversation today is the second of 3 that we have planned this summer. The discussion has been informed by questions from employees across campus, including those you've sent to your HR representatives, to the COVID response inbox, in emails to the chancellor and to your deans, and more. We're planning to host a third conversation in person and live streaming, so 2 options for all of you, on August 12th at Granger Hall. Stay tuned for more information. I would also like to thank our partners at McBurney Disability for captioning and interpretation today. You can find links in the event description below this video for those services. This video will also be available to watch later. Check the university's COVID response site for the link or revisit this YouTube page. Finally, I want to remind all of you that UHS continues to offer free COVID-19 vaccines to the entire campus community at the main UHS clinic located at 333 East Campus Mall. So let's get on with things. I would like to welcome our panelists. First, we have Dr. Nastia Safdar, who is a professor of medicine in the Division of Infectious Diseases and the medical director of infection control at UW Hospitals and Clinics. Dr. Safdar has provided guidance to the state of Wisconsin, to the university, and to UW Health throughout the pandemic and has served a pivotal role in pandemic response. Thanks for being here, Dr. Safdar.
Thank you.
Next is Amanda Jobach, Director of Prevention and Campus Health Initiatives at University Health Services. Amanda is a trained epidemiologist with more than 2 decades of experience. During the pandemic, Amanda led the campus data efforts around COVID-19, including the highly visited UW-Madison COVID-19 data dashboard.
Hi, Kelly. Good to see you.
You too, Amanda. And finally, Jake Baggett is with us. He is the Associate Director. The Associate Vice Chancellor and Executive Director, it can be a mouthful, Jake, of University Health Services. Jake has spent more than 30 years of his career in student health and well-being and student affairs. Jake's been an integral part of the campus pandemic response as UW's Chief Health Officer. Thanks, Jake.
Thank you, Kelly.
I appreciate all of you being here and having this conversation with me and my colleagues across campus today. I do want to emphasize, though, for panelists and for the audience, that what we're talking about today is not intended to be a conversation specifically around campus policy. The people here, the panelists, are people who have a lot of knowledge and guidance to share, as I think all of us are navigating transitions that we're undergoing in life and in the workplace. And so really that's what I'm hoping that we can talk about today. So to get started, I know I shared a little bit about each of you already, but I was hoping maybe you could tell us a little bit more about yourselves and the role you've actually served during the pandemic. Can we start with Dr. Safdar?
Thank you, Kelly. Hi, everyone. My name is Nasia Safdar. As Medical Director of Infection Control, one of the roles we play is to have a plan in place for any public health crisis that may emerge. And I don't think even in our wildest dreams we could have envisioned that something like COVID-19 would come about in exactly the way that it has unfolded. So the pandemic preparedness was done on the fly, and we're still building it as it happens, but we're in a much better place than we were a year ago, and we're grateful for that.
Thanks. Amanda.
Sure. Hi. So while I normally am working on a variety of health-related issues on campus, including high-risk drinking and sexual assault prevention, during this time as the Director of Prevention, my focus was really on the COVID data coming into campus. So that meant looking at the cases that came in, working with the outbreak team, managing the data that fed to our dashboard on a daily basis, just making sure that campus was well aware of what was happening on campus and in the community and in the state at large regarding COVID as the year went on.
Thanks. And that leaves you, Jake.
Thanks, Kelly. And certainly, it's been a very busy year and a half, and really from the beginning, I was involved along with many really competent and hardworking folks in responding, understanding, and then planning for how to navigate this pandemic successfully. So, really focused on the public health perspective, helping inform decision making and strategies across the board. So, thank you for this opportunity.
Yeah, thanks. I've been grateful to each of you for your guidance and wisdom and expertise throughout the pandemic. I know that I've frequently turned to all of you for guidance. So thank you for being here and helping share that with all of our campus colleagues. So I think one of the things that's probably biggest on a lot of our minds is, we're excited to return to campus life. I know personally I've been really glad to be spending more time here on campus, going to the terrace and coming back to the office. But if I'm somebody who's worried about being on campus with many more people, maybe than I've been around this past 18 months, or maybe I've been on campus all along, but have been working with fewer people overall, how can I make sure I am doing my best to stay protected from COVID-19? Maybe Amanda, could you get started with that one?
Sure. The number one most important thing that you can do is get vaccinated. We are so lucky to, science is so amazing the way it came up so quickly really, with these incredible vaccines, and it is the number one thing that you can do. The best way, if you're vaccinated, that you can continue to protect others, I guess I'll say, is, doing those public health practices that we said, in particular, staying home when you feel sick and trying to protect everyone around you. Really from diseases, even more other diseases from COVID-19. I mean, that's what we've learned, is that the same practices that we can use to protect ourselves from other respiratory diseases are the practices we use with COVID-19.
Thanks. Anything to add, Dr. Safdar?
No, that's exactly right. I think the biggest game changer for us all has been the advent of a number of these highly effective vaccines. So getting one as soon as one possibly could is the best thing to do.
Thanks. And I think we'll talk about it a little bit later probably, but wearing masks is something we can still continue to do, right, as vaccinated individuals?
Yes, it's certainly another step you can take if you feel like you need extra protection in certain situations.
Sure. So what do we know? One of the things we're talking about today is kind of what to expect campus to look like and how we can navigate that individually. But what do we know about employee vaccination rates right now?
Sure, I can speak to that. So for employee vaccination rates, We're still collecting information on employee vaccination rates and student vaccination rates. What we do know is that we live in an incredibly vaccinated county. Dane County has done a fantastic job in its public health efforts. And we now have, I think 70% of the population is at least partially vaccinated, and that population includes 0 to 11-year-olds who simply can't get vaccinated at this point. So if we're looking at those who are eligible or those who are going to be in our population, we're at nearly 80% vaccination rates. What we're seeing from our employees and what we saw from our students was an incredible response in getting vaccinations as those were offered. And it's a little bit, every year our population of students really changes by about a fourth. Some leave us. So we're always in the process of collecting more information. And right now we have several surveys going out. If you're an employee or a student and you've received one of those surveys, we've offered several different ways that you can provide your vaccination information to us. And we have a team working behind somewhere in these offices, working to upload those vaccination rates as we speak.
Yeah, and that's really important, right? Because the more employees share with us and students share with us their records, the more confident we can all be in our overall vaccination rates here on campus and make decisions accordingly.
Yes.
I would add to that. We've got several ways that you can upload that information. We certainly will help navigate that for you. But you can also just simply give us permission by responding to those messages that have been sent out to pull that record straight from the state registry. And then that's a very simple way, and you don't have to worry about it any longer that we have that information. So thank you for considering that.
Thanks, Jake. Nasia, as a clinician, I imagine you probably get this question from time to time, if not all the time these days. But do you have any advice for having conversations maybe with colleagues or friends or students who maybe haven't been vaccinated yet? They have some more questions, some reservations, maybe just waiting for more information?
I think the first and most important thing is to acknowledge and to really listen to the concerns that people may have. It's certainly true that this is novel technology. But, in terms of our thinking and our understanding, a year ago, I think the comment that, well, this is new technology and we don't quite know whether it's going to work as well and all that would have been a legitimate question to ask. But now a year later, when millions of people have been vaccinated and we are seeing firsthand the effects of vaccinations in our communities and the way the number of hospitalizations have gone down, the number of deaths have dramatically gone down. There's no other explanation for this other than the fact that vaccinations really gathered momentum. But the first thing is, of course, to listen and to address those concerns. And I usually turn to data to see if we can answer someone's question that way by simply displaying to them the data that exists that supports or refutes the position, and then see whether they have follow-up questions that we can help address. I think simply saying, just do it probably isn't an effective strategy at this point. We have to meet people where they're at and try to get them over to the side of getting vaccinated.
Thanks. I know as a science writer, this is something we encounter quite a bit, this maybe friction sometimes between people's beliefs and data. So is there a role maybe for sharing your own reasons for being vaccinated or sharing personal stories when having these conversations?
Well, I think personal stories are a necessary adjunct to the data. It's typically not an either or. Obviously, I think a local context tailored story is really important. What I can share is from the perspectives of healthcare workers, living on the edge of as this unfolded in the health systems, not knowing whether health systems were going to become the epicenters, and unfortunately they didn't. But having an option like an effective vaccine available and have it be readily there for it to be administered, it changed everything, not just the way that we practice, but our morale, our hope, our optimism for the future. And I really hope that can continue.
Yeah, I will say I felt maybe a relief I didn't anticipate after I got my second vaccine. So hopefully more people have experienced that or will soon. Mm-hmm. Anything you'd like to add, Amanda or Jake? I mean, I guess one question is we're still going to have, I mentioned that there is vaccination at UHS, but we're going to continue offering COVID vaccination.
Yes, we absolutely will continue to do that. We still have demand, and we will be prepared as people come back to campus, whether you're a faculty or staff person or students who maybe haven't had the opportunity to take the vaccine. We will have plenty of capacity to do that. And, so yeah, no worries there. Plenty to go around.
Great. Just as a reminder, that's at 333 East Campus Mall. It's the main University Health Services clinic, and it's available for employees and students. So we do have a high vaccination rate in Dane County and a high vaccination rate so far on campus. How should we be thinking about the chances for outbreaks in this environment where more people and maybe a lot of people are vaccinated?
Sure, I can handle that on campus. So our chances for outbreaks should be incredibly lowered come fall. That being said, there certainly will be pockets of people who are unvaccinated, and they are at risk, remain at risk for a very serious disease that can have long-term consequences for them. So we'll continue to monitor any cases that arise on campus. I think, what does it mean for you also asked about the chances of encountering someone on campus who has the virus. Testing will still remain quite available for all students on staff 5 days a week. And we know that having someone, and this just reiterates the importance of really taking care when you first come up with any symptoms here on campus, thinking about going and getting tested if they seem to be COVID symptoms, and maybe staying away from campus when you're feeling ill, making sure to take care of yourself and protect people from all the transmissible viruses.
Great. Anything else? Yeah, I mean, I think about the fact that there might be pockets of unvaccinated people, and that's why it's really important to continue to seek vaccination if you have not already, and have some of those conversations with people who might not be there yet. I do wonder, in the US, I think in particular, we're very fortunate here to have such easy and free access to vaccination in the United States. We've tended to think maybe about vaccines as preventing us from getting sick with COVID-19. But as more people are getting vaccinated, I think we're all starting to hear stories of breakthrough infections. So how should we actually be thinking about vaccines and what they do for us during this pandemic? Maybe Dr. Safdar, you could take this one. Sure.
So the greatest value of the vaccines is that they prevent people from getting severe disease and requiring medical care or hospitalization. And that by itself, is tremendous and really something that we needed at all times during this pandemic. Now, even though these vaccines are wonderful, no vaccine is 100% effective. And so when we talk about breakthrough infections, we're talking about people who've been fully vaccinated, but when exposed to COVID might still experience an infection. And those infections are pretty dramatically different from the infections in those who haven't been vaccinated. These are mild infections with mild symptoms, full recovery, and generally not the need for medical care or hospitalization. So it becomes a very different syndrome in those who are vaccinated. And for that reason, even though breakthrough infections is something that we monitor very closely and are concerned about and look for in order to figure out best ways to address them, they're much attenuated in those who are vaccinated.
So if you're vaccinated, Dr. Safdar, you said you have a much lower risk of having to go to the hospital. You're better protected against severe effects of COVID-19. As you mentioned at the outset, we see this in the data. There's been a really dramatic decline in hospitalizations and deaths, especially among vaccinated people. But a lot of us, and I'm one of these people, I haven't been sick in a really long time. And I think when I first started to go back out again in public, I realized I was pretty worried just about being sick in general. Is that okay? Is it okay to feel worried about being sick?
I would say that, first of all, it's completely understandable. We all, I think, kind of had to deal with that adjustment, going back out amongst folks after we were taking all these extra measures to protect ourselves. The vaccine is a game changer around that. But we learned or relearned some really important public health practices that we were taught and maybe, didn't pay as much attention to. So those practices like, washing your hands, really paying attention if you're experiencing symptoms, and then taking care of yourself and staying home. So we just need to support that among each other as well as paying attention to our own selves. And that will impact the spread of other, viruses that we deal with as a matter of routine.
Yeah, and I think it's just a quick reminder, campus continues to provide testing for COVID-19 5 days a week. So we'll have, I think, updated information about test site hours soon, but we will continue to offer testing. So I think, Jake, what you're suggesting maybe is, if you're symptomatic, you have access to testing if you want it.
Absolutely. If you're experiencing any of those kinds of symptoms, just go ahead and get tested. It's easy, it's available, and then you'll know what steps to take. But most importantly, take care of yourself. Don't share the virus, no matter what it is.
With breakthrough infections, Dr. Safdar, even if we don't get severe, vaccinated people are less likely to have severe symptoms or be hospitalized. How should we be thinking about things like long COVID or other lingering effects that people who have been sick with COVID have experienced?
So it sounds like there is a correlation between the severity of your initial COVID symptoms and the post-acute symptoms of COVID, or the long haul syndrome as it's being called. Now, having said that, there's a lot we still don't know about this long haul COVID, in terms of the duration of symptoms and exactly the populations that are most likely to get it. I think in the world that we currently live, if you approach risk as a spectrum, all the mitigating measures that we just talked about will reduce your risk to as low as it could possibly be. But it probably can't be a zero risk situation just because the virus is still around us and is likely to remain around us for the foreseeable future until we come to a point where the global vaccine uptake is at a much better place than it is now. So if we change our mindset to thinking about it risk as a spectrum and, what are the steps that I can do to reduce my risk to as low as possible, then the vaccine and the masking and monitoring your symptoms and staying home when ill, all of those things will do that.
Thank you. As a quick reminder, I want to thank again our partners at McBurney Disability for providing captioning and interpretation. So if you're just tuning in, you can find links to those services in the event description below the YouTube video here. So I can't believe it's taken 20 minutes for us to get here, but Delta variant. Let's talk about the Delta variant. I think a lot of us are thinking about it, talking about it, reading about it right now. So maybe we can kind of just quickly tick through some of these since a lot of people have questions. Are our current vaccines effective against Delta?
Yes. There's we've got plenty of experience now and some data that's telling us that it's really doing this a very effective job at preventing the Delta variant. So you should have some level of confidence that you're protected if you've been vaccinated.
What do we mean when we talk about variants? What are they?
So I can take this one. So, respiratory viruses will typically adapt, and Amanda, you can speak to that as well. But these mutations are not unusual. It's just that many times we don't know that they're happening because they're inconsequential and it doesn't confer any advantage to the virus. In the case of Delta, the advantage that it's conferring to this virus is that it makes it more easily transmissible. And so that's why I think people have been concerned that if it's easily transmissible and the vaccine, if it were not effective, what would that do? Fortunately, we're finding is that the vaccine's effectiveness is holding in the case of Delta. But I think that keeping an eye on the Delta variant, and of course, we know how quickly it has spread, those are going to be prudent things to do now in the foreseeable future.
Will there be other variants?
Undoubtedly.
Yes.
Yes, unfortunately. And I think, Nazia, maybe you or Dr. Safdar, you spoke to this a little bit. The fewer people in the world that we have vaccinated, the more opportunity the vaccine has to spread and undergo these changes that sometimes will confer an advantage to the virus.
Yeah, sometimes, although we don't like to do this, but sometimes it helps to think about it from the virus's perspective. It's really looking for the path of least resistance to survive. And that path of least resistance for the virus is people who are not vaccinated. So as long as there's that pocket that continues to exist, the virus has a chance and it's going to take it.
So how can unvaccinated people protect themselves from Delta?
First and foremost, please consider getting vaccinated. Answer the questions that you have, talk to the people that you trust, talk to your healthcare provider, and really take some time and think through, what's the best decision for you, and we hope that that's for you, that you're able to take the vaccine. And then, otherwise just continue those other health practices that we talked about before. Continue to wash your hands. It's okay to continue wearing a mask. Many of us have gotten comfortable with that, and it is effective against controlling the spread of other viruses as well. It's not as necessary because you're vaccinated, but many folks will have a level of comfort with that. And then be careful about the folks that you're around. If you're around folks that have a high level of being unvaccinated, just be extra careful around that.
Well, that was actually my next question, Jake. Do vaccinated people need to be worried about their own risks if they are around unvaccinated people?
I think unvaccinated people should have a really low threshold for doing all the other public health measures that are important. And even for vaccinated individuals, just because there's no mask mandate or requirement, it doesn't mean it's not a good idea if you're in an indoor public gathering for a prolonged period of time with people whose vaccination status you might not be fully aware of. So there are going to be settings where you will want to have a low threshold for pulling out your mask, especially when other respiratory viruses are circulating as well. And so having that handy, I think, is a good idea.
Yeah, I've had a lot of conversations with friends, and a lot of us are planning, even, when we travel in the fall on planes, regardless, here and in the future, why not wear a mask? I would prefer not to get other people's colds. So what if you're vaccinated, but you're immunocompromised and maybe are worried that your vaccine is not as protective for you? How should you be thinking about your risks, particularly with Delta being more transmissible?
So a lot depends on, the level of immune compromise and your own aversion to risk. I would say for my patients, for instance, many of whom are immunocompromised, I've been saying that we don't know if the vaccine works as well because it really requires a host to generate that immune response. And if your immune system is compromised, you may not be able to generate that immune response as well as if it were not compromised. And so continue those measures. So wear a mask when you're going out. In small settings where you know the status of people around you, especially if these are outdoors, you probably don't have to be as worried. But closed indoor settings with large groups of people for prolonged periods of time, it just goes on the higher risk end of the spectrum. And so masking in that setting and avoiding people with symptoms of respiratory illness is a good idea.
All right, next one. What if you're vaccinated and you feel confident in your vaccine and you don't have any reason to suspect you have any health issues that would leave you more vulnerable, but you have maybe at-risk family members at home? Maybe they're immunocompromised, whether or not they're vaccinated, or maybe you have a child who is too young to be vaccinated at home. How should you be thinking about your risks of passing COVID on to those individuals? And is there anything you can do to sort of mitigate risks to people around you?
I can start by, and Amanda, if you'd want to weigh in on that as well. I think the chances of vaccinated people with asymptomatic carriage of the virus is not zero, but it is very, very low. And so you can be pretty, as assured as one can be in the pandemic with everything that you've done, that your chances of bringing home something to your loved ones or family members is very low in the setting of having been vaccinated. If someone is sick in the household with COVID, for instance, even if you're vaccinated, if you're caring for them, if they can't be isolated, if distancing is not possible, then you would probably want to wear a mask when you're taking care of them, because even if you're vaccinated, your exposure to the virus is now quite intense because you're right there with them and caring for them. And that's a setting where you may want to wear a mask.
Yeah, I really agree with everything that Nancy is saying. And I think, it's also important for me as an epidemiologist, what I also think about is kind of the population exposure that's happening at this point. And again, the fact that we live in a county that has such high levels of vaccination means that you, in your day-to-day life, in your work life, in your experiences in this community, your levels of risk are quite a bit lower. I can just say that I read every case that's associated with UW-Madison, all throughout the year, and so much of what is happening right now. Travel is a little, when you leave our community, that's a little bit higher risk. That's probably where you're more likely to encounter potential exposures when you're going to states that have much lower levels of vaccinations or countries that have lower levels of vaccinations. So our day-to-day exposures here on campus, in our community, should really place you at pretty low risk, especially if you're vaccinated yourself.
Thanks, Amanda. Thanks, Dr. Softer. I know there's a lot of monitoring happening by public health agencies all over too, looking at the risks of, whether as a vaccinated person you have lower risk of transmitting COVID-19 to other people. I think there's pretty good data at this point to suggest, and somebody could correct me if I'm wrong, but that you're more likely to have a symptomatic infection if you're vaccinated. And so I know one of the things I was worried about last year was having an asymptomatic or pre-symptomatic infection and giving it to somebody. And so I did a lot of spending time at home for that reason. I know that on campus here, a lot of us are working hard to share as much of that information as quickly as possible as soon as it comes out. So speaking of, preparing for coming back to or reuniting with our colleagues here on campus, I'm hoping that maybe between us, we can offer some guidance or advice to people who maybe are coming back and they're getting ready to meet in their office for the first time with a colleague or with a student. What if you're somebody who's worried about being vulnerable, and again, you're just kind of getting back into this, and you don't know whether the person you're meeting is vaccinated? How can you start preparing now for some of those interactions?
Well, first of all, I think you should give yourself some time as you're transitioning back to campus and start being around people and more people in general. And of course, as we keep saying, you get vaccinated yourself. That's going to give you a great level of protection. And then, if you're scheduling a meeting with somebody, maybe part of your standard protocol might be to just remind folks that if you're not vaccinated, we'd like you to wear a face mask, and that's the expectation. And that will remind people that they haven't been vaccinated, but maybe they should be prepared for that. But again, I'm more comfortable with that because I know I'm vaccinated, so I have less worry about that. But it's going to take time for us to adjust to being around folks. And so, maybe ease your way into that, and I think you'll find yourself getting more comfortable with experience.
I think having a script and practicing it a few times will also help to ease it if the moment actually arrives. And for many of these one-to-one and one-on-one meetings, it is possible to maintain some semblance of distancing as well, and there's no harm in that. It helps prevent the transmission of influenza, for instance, and other respiratory viruses. So anything that one can do, thinking even beyond COVID, is good for this.
Would any of you feel comfortable sharing maybe some of the ways that you started transitioning? I can say the first thing that I did is I went to a coffee shop, and it was one that had, a sliding door. So most of the room was pretty well ventilated, but I went indoors to a coffee shop and had a coffee with a vaccinated friend. And that was really a helpful way for me to start getting used to the idea of being around other people again. But is anybody comfortable sharing maybe some of the things they have done?
I can say, I think in particular in the work environment, it was actually stranger to just be in the building again. That it felt a building that we had been barred from entering, for quite a bit of time. So I sort of came in very quiet hours to begin with, times when very few people were going to be there, so that I could sort of get used to this environment again and remind myself what it was like to be here. And then I think just slowly starting to come in when maybe a few people would be around. And at this point now, it feels natural again. It feels great to be here, actually.
It takes surprisingly little time to get back to feeling natural. I mean, in the beginning, there's a lot of trepidation, but within a few days, you feel like you're back at full speed.
Like a lot of folks, I spent a lot of time on campus around people that I had great confidence were following all the health protocols before the vaccine was available, and of course, continue to do that. But out in the community, going to a store where I wasn't sure about other people's status. Once the face coverings didn't become as critical as they once were, it gave me pause. I had to stop and think about it. But then again, I reminded myself that the vaccine is protecting me. It's done a very good job, and it continues to do well. And it just, you adjust. But I carry a face mask with me just about everywhere I go, just in case I want that added layer of comfort. But again, I feel very comfortable going out and about and around other folks at this point.
Do you have any particular advice for maybe our colleagues who never really left campus? I mean, we know that we have many essential employees who are here throughout. I have a friend, for instance, who's a researcher, and she remained in her lab. And I know one of the things that that her lab did is they had conversations early on about masks and personal space. But what about for others on campus who they're not coming back? They've been here. They're getting used to other people coming back.
I don't know that I have any particular advice for them. I think the people who have been here on campus are going to experience a different range of kind of how they're experiencing a more crowded campus coming in. I'm still honestly, I mean, it's been nice in some ways to come back in the summer when we know we have a quieter campus. I don't really know what it'll feel like when everyone is really back here. And I'm sure they can't really anticipate that, but I think just kind of sharing with their colleagues and talking through maybe what they did differently while others were away.
That I just want to acknowledge and thank the folks that have done that, who have fulfilled those roles that necessitated them being on campus, and and just doing so diligently, and providing support and protection for the rest of our campus. But yeah, it is as more people come back to campus, we'll again go through sort of an adjustment of our comfort levels with that, and I think you'll find yourself doing that more quickly than you might think.
And welcome back, Dr. Softar. I think we lost you for a minute or two there.
Yes, if I could only control technology, we'd be in great shape.
I think we all feel that way, right? I was hoping maybe we could go through kind of a quick round robin style, thinking about things that are maybe things we haven't thought about in a while, because we maybe haven't been using campus or campus services in quite the same way. But if you're vaccinated, and I want to assume that most of us are vaccinated, knowing the high rates of vaccination in our community, is it safe to ride the bus? Yes or no?
I would feel comfortable doing that. Yes.
I would ride the bus.
With a mask on, though?
Yeah.
Yes.
Legally, yes.
How about using a public restroom on campus?
Absolutely.
What about eating or grabbing food at a campus dining facility?
I'm afraid I do that daily.
How about going to the unions, including theaters?
Yeah.
Very confident.
Yes.
Looking forward to it.
What about libraries and campus museums?
Certainly.
I think so. Yeah.
What about teaching in a large lecture hall?
Yeah.
Any particular considerations?
I mean, I think that this is probably a really individual decision. I mean, if you're the kind of person who is really risk averse, and many of us are, and then, again, there's no harm in wearing a mask. I don't know that I feel it's necessary if you're fully vaccinated. But if it makes you comfortable, a lot of it is, about having the comfort level internally. So if it makes you comfortable, there's no harm in it.
I think in general, I just say as an epidemiologist, the word safe always is a bit of a struggle for me. There's almost nothing we do in life that's risk-free. We live with risk, and sometimes it's less and sometimes it's more, but the rewards of living are worth the risks we take in a lot of time, in a lot of ways. So I don't think, I think the thing that actually is very changed for me in being vaccinated is that I'm not a risk to others. That was always what was so hard for me during during the time before I was pandemic, mostly what I was afraid of was that I was going to be a risk to others in any of these situations that we've outlined. And so for me, the rewards of doing these are override any small risks that might be associated with them. But obviously those will be different individual decisions. Maybe if you hate seeing plays, going to a theater would never be worth the risks for you. But I do. So, these will come with some individual decision making.
Yeah, no, it's a really good point. I think we've talked about the risks of even just getting behind the wheel, and most of us have decided in life we accept that risk.
Mm-hmm.
It's been probably difficult for a lot of us moving through the changes over the course of this pandemic, right? When we had maybe a year ago when everybody was vulnerable, and now knowing that even the most vulnerable people or the people who are most likely to have hospitalizations and or die from COVID are now protected or have access to full protection. So thank you, Amanda, for talking about the spectrum of risk, because I think that's important. Safe or unsafe is maybe not the right way to frame that. It's not a binary, right?
This certainly seems to be the right time in the pandemic for us to undertake all these activities. There's a cost to not having done those for a while, and it was necessary while it was necessary. But now I think it is time to re-enter and fully engage.
Thanks, Dr. Safdar. So as we're doing that, and we talked a little bit about breakthrough infections, let's say as a vaccinated person, I develop symptoms, whether or not it's related to the workplace, but just now moving forward in this sort of new reality, and I go get a COVID test and it's negative. So the COVID test says I don't have COVID, maybe I have a cold or I have the flu or some other respiratory illness that we're used to. What should I do? Should I come to work? Should I go to the grocery store?
You should stay home until you're fully better, regardless of what the respiratory virus is. This is going to be a bit of a culture shift for all of us because we've been so used to throwing ourselves into our work that if you have a cold or a sniffle, you might think, I'll just go in. It's too hard to get other people to cover for me. But that culture shift has now happened with COVID, and we need to preserve that it's not okay to be at work if you're feeling sick, regardless of what the cause might be.
That I totally agree with Dr. Safdar that, if you're not well enough to come to work, you probably don't need to be working remotely either. Take care of yourself. Take that time to recover and get well.
Yeah, thanks. What if I'm not sick, but somebody in my home is, and whether or not they have COVID, maybe I don't know, but my kid is sick or my spouse is sick. Should I come to work?
I think for the most part, yes. I think you'll want to monitor your own symptoms carefully, and that might include doing a temperature monitoring and making sure that you're not developing any symptoms of a respiratory illness. Sometimes those symptoms are pretty insidious and low grade, so an intentional check on yourself is going to be important. And if it turns out that the individual family member does have COVID, then you might want to make sure that you're not in the incubation period for it.
Thanks. That probably applies too if you know you've been exposed to somebody with COVID. If you're a vaccinated person, just keep an eye out for symptoms, right?
Mm-hmm. Exactly.
Amanda, I'm sorry if you were going to say something. I didn't mean to stop you.
I was just thinking, we had my daughter came down with the first respiratory virus we had since COVID a few weeks ago. She's vaccinated, but we didn't know, and so I think it is a good idea to kind of think through what your plan is, like what you want to do. We weren't in a place where it was easy to get a COVID test, and I kind of thought, I kind of wish I had a few of those home antigen tests, just so we could kind of check. She's pretty symptomatic here. I think sort of thinking through what is your plan? What are you willing to do? What feels safe? What feels comfortable to you is a good idea. Have some supplies on hand. Maybe be better prepared with knowing the right website to look at for where you can get tests. We were able to in a day, but it, and she was luckily negative, and everything was fine. But I just kind of realized a few things that I wanted to have on hand for when people get sick again in our houses. And just also to say we were with my parents who are elderly and at risk, but everyone around us was vaccinated. And it did the level of of terror that I would have felt prior to everyone being vaccinated was so ameliorated by the fact that we had all undertaken the right protections, and we're doing the right things at the time.
You know, that's a really good point. I would just add that there are many people who live by themselves. And so if you're in the throes of a respiratory illness, you know, now is not that time then to go out running for Tylenol and Kleenex and all that. So
Right.
having a kit at home that you can readily remember where you put it is going to be important.
That's a really good idea.
Mhm.
All these things we never really thought about before. Yeah. And Amanda, thanks for sharing that, because I think you probably described what a lot of us have felt, right? We've gone from, this feelings of terror, I think, for some people. And I would say I felt that way too, and share your concern early on. I was just terrified of giving somebody else COVID without meaning to. But and now it's hard because we're all having to sort of change our mindset, and we're getting there, right? But it takes time. So, and hopefully, more conversations like this are helpful. What if you are somebody who is still just feeling uneasy? Who would you recommend they talk to? Uneasy about coming back to work, or about, maybe sending a child to school in the fall, or returning to, concerts, or even just outdoor sporting events and things like that. Where's the right place to go for that reassurance or advice?
I think, for medical care questions and the like, or, could this still be COVID, for instance, if I have symptoms, even if the test is negative, those kinds of things, I think your medical provider would be ideally positioned to answer. But also, I think for more general questions, having a couple of reputable sites that you would go to, such as the CDC website, for instance, and for our local information, the DHS and the UW websites are key. We, of course, know we've been combating a lot of misinformation, and some misinformation is really credibly packaged with names like physicians in the title and so on. So it's hard to know what's real and what's not. So if you have those reputable sites and you only go to those, that will be a good thing.
Yeah, I've been following if you're following people on social media, I've been following your local epidemiologists and Dear Pandemic, who have covered almost every topic I can possibly think of in really educated ways, and really conversational and easy to understand ways. So there's a lot of great resources. I think finding some of those trusted ones can be helpful.
That's a great idea. I know I love podcasts, so I've had a lot of podcasts that have been getting me through. I think one question some of us have, especially, vaccination started for most of us for the earliest among us in December and January. And so there was some idea early on that maybe after 6 months we'd need a booster shot for COVID. Where are we right now? Do we need booster shots? What should we be thinking about?
I don't think we really know that at this point. I think that there's some studies that are ongoing that will tell us. It's a little bit hard to determine the need for a booster because it's not just the antibody response that determines that you're protected. There's a whole host of other responses in the body that can also be called upon to bear to protect you as a consequence of the vaccine. So it may be that there will be a small subgroup of people who need the booster, but I think that question is really unanswered at this point, and it really would be speculation.
Sure. And I know there's a lot of enthusiasm for vaccine authorization potentially for some children under 12. Is that something we should expect this fall? And any idea when we might have full FDA approval of our current vaccines? And it's okay if we don't know.
I think it would be hard to say for sure, but I would say soon, quite soon is when we should expect to hear more about that.
Yeah.
Great. And I imagine there will be lots of information about where and how to access vaccination for that age group when it comes. Something I keep thinking about, and I know we're seeing an uptick nationally in cases, and that kind of tracks with what we saw last year. There's maybe a seasonality to this virus potentially, and I know that we're headed into respiratory virus season anyway, where we might end up with more illnesses that look like COVID or like influenza. Would we expect, regardless of vaccination, to see an uptick in cases this winter? How should we start to think about like COVID cases as we get to the respiratory virus season?
Well, I think we're going to see a good mix of respiratory viruses, and the way the surveillance is done is often is syndromic. So it might be influenza-like illness, and that includes all respiratory viruses. This past year, influenza-like illness really meant COVID surveillance because there was no influenza circulating. But I don't think that's going to be the case this year. And so with that, we'll have a pretty good sense of what the mix is that's going around. And then the state lab and other labs around the country do surveillance that's lab-based. And so you know what proportion is COVID versus what proportion is other things. So the existing infrastructure, I think, will be able to tell us in a pretty good way what's circulating where and by how much.
I would add to that, if you haven't considered getting the flu vaccine in the past, just really encourage you to reconsider that decision. That'll just take maybe some of the confusion or the possibility of getting infected out of the way, and the campus is going to have a very robust flu campaign to make it available to you at no cost. So look for more information on that coming out real soon. Really take advantage of that.
That's great, Jake. I know I take advantage of my campus flu vaccines every year. Well, I think we have a few minutes left, but I really would like to hear maybe some closing thoughts from each of you. Again, knowing that we have a lot of colleagues who are coming back to campus after having been away for a while, or who have been here but are now welcoming more of their colleagues back to campus. Jake, could you maybe share some of your parting thoughts with people, what you hope people leave with from our conversation today?
Sure. Well, first of all, I just want to thank folks for everything that they've done and continue to do to support all of these efforts. They've absolutely made a difference. Now that we have the tools that really work like the vaccine, we're in a much, much better place. So thanks to the folks that have shared that information about their vaccination status. It's certainly not a requirement, but it's very helpful to have that information. And we're trying to make that as easy as possible. So if you're able to, please share your status, and that'll just give us a more complete picture of what we are seeing on campus. And then I'll say again, take the flu vaccine if it's available. That will just add take another worry off of your concerns for this fall.
Amanda.
Sure. Yes, if you haven't been vaccinated, please get vaccinated. You can email me if you want to ask any questions about vaccines. I'm happy to talk to anyone about it. And if you are vaccinated, I think the thing that I keep reminding myself is I've done it. I've done everything that I should be doing to protect myself. I've taken the largest step to protect me, my community, my family. We waited a long time for this, and it's amazing we have it. And if you are vaccinated, you've done it. You did your job. So I think you can feel confident in that, and know that we're still here monitoring anything that happens here on campus. And yeah, welcome back.
And Dr. Safdar.
I think I would echo just exactly what Amanda and Jake said. It is time to welcome people back. And this is a time for optimism in our local community. Our rates are good. The virus is attenuated. And changing our mindset now to, just as Amanda said, you've taken all the steps, you've done everything you could, and we're in a better place now, a much better place than we were a year ago.
Thanks. And may I recommend, if you haven't hugged friends yet, hugging friends is the thing I've been most excited to be doing again. So thank you, panelists. Thank you to the audience. Really very grateful that you're all here and that we can all have these conversations. And I just want to remind everybody that our next town hall is coming up. So we'll be doing this again, but we're going to be doing the next one in person. We will also live stream. So if you can't make it, or you're not quite ready to come make it to an in-person event yet, we will be providing a link for you to watch that online. So again, that's going to be on August 12th at noon at Granger Hall. You can find more information on the COVID response website. You'll find a link back to this video recording or today's town hall at the YouTube link that you're on now, or also on the COVID response website. And I'm sure we'll be sharing more information in campus messages soon. So as we depart today, If nothing else, please, if you have not yet been vaccinated, talk to your healthcare provider. If you have questions, you can reach out to University Health Services. Even talking to a vaccinated person that you trust is not necessarily a bad place to get started. I think hopefully you've heard today from all these folks that getting vaccinated is really the best thing that you can do for yourself. It's also the best thing that we can do for the people who we love and for our community. So with that, I will leave you all. Be well, and we will see you next month. Thank you so much.
Thank you.
Bye.